This segment sponsored by Viking Psychiatry. It's time for Mental Health Matters with Viking Psychiatry, and today we're discussing the fact that millions struggle with depression that doesn't improve with traditional medications. Sean Goddard from Viking Psychiatry is here to talk about new science and treatments. Good morning.
Good morning.
How's it going?
Good.
Good to see you.
Same here.
Okay, so let's talk about this because treatment-resistant depression. Okay,
Yep.
treatment-resistant depression. Can you break down what that is? Because this may be a new term people have not heard.
Sure, and we call it TRD for short.
Okay,
that's
that's
easier. Right? So technically, what's been defined as treatment-resistant depression is somebody that has failed 2 or more medications, let me rephrase that have been failed by 2 or more medications. Not that they've failed it, but those medications have failed them in the treatment of their depression. And so if you've had 2 medications that have failed you, then you are defined as somebody who is potentially treatment resistant.
And so why is it that treatments or medication don't work on certain people?
Yeah. You know, in psychiatry for a long time, we've been focusing on something called the monoamine hypothesis, right? And that hypothesis said, well, depression is because you're short on serotonin, right? Or dopamine or norepinephrine, right? These different neurotransmitters that are involved depending on the disease process. And so if we give you a pill that will increase your serotonin, then we can make you not depressed.
Right.
But what we have found out over time is that it's not that successful, right? There's a huge study out there called the STAR-D that says by the time somebody gets to their 3rd medication, they only have about a 14% chance of success with that 3rd medication. And if they're lucky enough to be in that 14%, 65% of those people will be back in a depressive episode within 3 months, right? So traditional medications look at focusing on neurotransmitters when really what it often comes down to is a network disconnection issue in the brain.
Okay.
And those medications don't address that.
And so, and we've talked about this before, one of the challenges with traditional medications is the fact that once you're put on it, it takes weeks to take it to even see if it starts working, and then you have to fail that one, and then you have to go to the next one. And that can be a draining process, especially if someone is currently experiencing depression. And so with your approach being more holistic and offering a variety of advanced treatments, what type of hope can you bring to people who are suffering from being resistant to the traditional meds?
Yeah, a lot of the treatments that we offer are focusing on making changes now. Right?
Yeah.
Not having to wait 6, 8, 12 weeks to feel better, hopefully. And a lot of the treatments that we offer focus on that network disconnection and reconnecting, those disconnections, right? So for example, in depression, that amygdala goes into overdrive and it drives fear and ruminating thoughts because that frontal lobe is not addressing and calming it down. And so as we treat it with treatments like TMS, ketamine, Spravato, we begin to reconnect that, right? And so that frontal lobe is able to tell it to quiet down, right? Calm down, and those kind of negative and ruminating thoughts and fears begin to dissipate. And we also see something very important, and that's the reward system reconnecting, because a lot of people struggle with something called anhedonia, which is a lack of joy in life, right?
Wow.
And we see that often even with people that are treated with traditional antidepressants. They say, well, I'm not really sad, but I'm not really happy, right? And some of my clients call that the zombifying effect, right? That's not successfully treated depression, right? And so as we reconnect those networks, then that reward pathway begins to reconnect, and we begin to experience joy again, right? And finding reward in life and realizing that all those negative thoughts of that I'll never succeed, I'm never going to be happy, I'm broken, there's something wrong with me. These are things I hear all the time in practice, and they realize that they aren't broken, right? That there isn't something wrong with them. It was just the treatment that they were using that was failing them. And so as we use these treatments and we reconnect those networks, we see life changes.
Yeah, repairing the networks is so important. So right now, with people wanting that immediate result that you're talking about, are there ways that people can actually skip over having to take some of these traditional medications and be able to come see you for your instant treatment?
Yeah, absolutely. Some of our treatments are still FDA regulated, right? Like Spravato, there's certain requirements that you have failed at least two to three meds, right? And insurance requirements. So those and TMS are very similar if you want to go the route where insurance is paying for those treatments. However, we do have options through ketamine-assisted psychotherapy, and we can even use TMS without insurance involvement, and that allows us to kind of bypass that. The good news is for the example Spravato, it just received FDA approval for monotherapy, meaning it can be used by itself. You don't have to be on an oral medication to be able to get it, and up to this point you've had to. Now, we're waiting for the insurance companies to update their policies to match that approval, so we're still struggling getting people to be able to get it without being on an oral antidepressant, but I'm very positive that in the next 6 to 12 months, those policies will begin to catch up and people will begin to be able to get the Spravato without having to be on an oral antidepressant. So
that's exciting. It is. Okay, so people can just get started by coming to talk to you, calling. Do you offer free consultation?
Yeah, so not a free consultation, right? But we work with most major insurance companies, right? And so they come in, sit down with me for up to an hour of assessment and looking at their history and determining if they're eligible. And then also collaborating with their current treating provider as far as their psychiatrist, psychiatric nurse practitioner, whoever they're seeing, primary care doctor, creating communication lines and making sure this is an appropriate, one of these treatments are appropriate for them. And then our goal is to get people started as quickly as possible because we know, I personally know, having gone through 3 years of treatment-resistant depression in my mid-30s with failure after failure, we don't want to wait 6 months, a year, 2 years, 3 years to feel better. We want to feel better now, and so our goal is to get people moving forward into feeling better.
Okay, well, thank you so much for sharing. And for those who are struggling with treatment-resistant depression, Viking Psychiatry is offering new options and new hope. Their contact information is listed below, and I'll see you after this break.
This segment sponsored by Viking Psychiatry.